Home care instructions. General anesthesia. Make sure the patient is accompanied by a responsible adult until they are alert and coordinated enough to walk without the danger of falling. This is particularly important if the patient should rise on the evening of surgery to use the bathroom. The patient should not drive or operate machinery until the effects of the anesthetic agents have dissipated. The time required will vary with the length of the anesthetic procedure. This will take at least 24 hours. Local anesthesia. It is important not to consume any hot food or drink, or chew any solid food until the effects of the local anesthetic are totally gone. This is particularly important in children. Bleeding. Slight bleeding, oozing, or redness in the saliva is not uncommon. Excessive bleeding may be controlled by first rinsing or wiping any old clots from your mouth. Then, placing a gauze pad over the area and biting firmly for 30 minutes. If bleeding continues, bite on a moistened tea bag for 30 minutes. To minimize further bleeding, sit upright, use ice packs, avoid strenuous activity, and do not become excited. Exercise. Routine exercise is permitted 4 days after surgery. Heavy or competitive exercise before this can potentially cause bleeding. Nausea. Nausea can be decreased by having the patient lie flat or with the head slightly elevated and having minimal movement. Anytime the patient gets up, he or she should do so with slow movements and assistance. Ingest only clear liquids to help minimize nausea. Water, 7-Up, ginger ale. Pain. Use your prescription only as directed on the label. You should take the pain medication before the local anesthetic wears off. You may take one pain pill as soon as you get home, and then another one as soon as any pain is felt. After taking the second pill, take the remainder as prescribed on the label. Take a full 8 ounces of clear liquid, water, 7-Up, or ginger ale when taking the pain pills to minimize nausea. If not allergic, you may take 600 milligrams of ibuprofen, Advil, Motrin every 6 hours to help with pain control. Do not take acetaminophen, Tylenol with the prescribed narcotic, as the formulation prescribed has acetaminophen, Tylenol in it. Mouth rinsing. Begin rinsing with warm water gently around the surgical site the day following surgery. Rinse with a full glass of warm water. Perform this rinsing 4 times per day if possible. You may also resume brushing your teeth, avoiding the surgical sites. Over the next few days, you may start brushing over the surgical sites gently, gradually increasing the force of cleansing in these areas. Avoid foods like nuts, popcorn, and raw vegetables until the sockets are totally closed, 6 to 8 weeks. Implant. If you had an implant or implants placed, do not use an electronic toothbrush or water pick, e.g. Sonicare, over the areas for 4 months. No biting or chewing over implant sites until crowns are placed. Bone graft. Refrain from straw use, carbonated beverages, and heavy swishing, rinsing for 4 weeks. You may feel sand-like particles coming out the first week or 2. Swelling. Swelling may be minimized by the immediate use of cold packs for the first 8 to 12 hours. Apply the cold pack to the outside of the face directly over the surgical sites, 30 minutes on and 30 minutes off while awake. Warm, moist heat. A hot water bottle or a warm, moist towel may be used over the outside of the face, 30 minutes on and 30 minutes off, starting on the second day after surgery and continuing until all swelling and/or bruising is gone. Diet. It is important to maintain an adequate intake of fluids and nourishment for optimum healing. A high-calorie, high-protein diet is recommended. If solid foods cannot be taken, supplement a balanced soft diet with 2 or 3 servings of a liquid dietary supplement, such as Meritine, Ensure, Sustacal, Nouriment, or instant breakfast. Avoid hot or hard foods for 48 hours because these can dissolve or dislodge the clot. Also avoid using straws or spitting because the negative pressure created may cause premature loss of the blood clot, resulting in a dry socket. Smoking. Smoking increases the incidence of post-operative complications, specifically dry socket, and should be avoided for 1 week following oral surgery. Antibiotics. If these were prescribed, please take as directed until they are all gone. If you take birth control pills, their effectiveness may be decreased, and you may have an increased chance of pregnancy while simultaneously taking birth control pills and antibiotics. During the time you are taking antibiotics, you should use another form of birth control.